And actually, well, I have worked for 10 years in a smaller unit that's subservient, if you like. It's a sort of feeder unit, a bit like the Countess of Chester.
Mm.
And again, it was just uh, totally divorced from what I've been hearing here. The standard of care was excellent.
Mm.
It wasn't at the same level as the main centre, but you know, you just have to look at that picture again, and it's a picture. It's just
Mm.
devastating
Mm.
when you think that all of that help that was required wasn't factored in when it comes to the context of what happened.
Mm.
It's a quantum leap um, between the two. Um, I still call her Nurse Lucy in all my communications, or in any of these slides. Um, and it's an absolute tragedy. Apparently, she was a really good nurse, and she would have loved to work in an area like that. I'm sure she would have. I'm sure she would have done really well, just like all the other staff. And I think a lot of the time is the opportunity, the ethos that you get to work in a unit like that. And they've always been like that. The nurses there have always been really good and high skill level with the training they get from the doctors. And I think that's one of the biggest things that the doctors bring to it is training the nursing staff. And then the nursing staff are their eyes and ears, and they're so well informed.
Mm.
And they'll do lots of procedures that are quite complicated. You wouldn't be expecting nurses to do. And everybody after the pandemic would say, "Oh, nurses do a great job," and things like that. And you would have been expecting that Lucy would have been working towards getting, promotion. There was no chance in that unit because they were getting rid of any promoted posts.
Mm.
So she would have had to go elsewhere to get promoted. But by all accounts, she was one that went there. People went to and asked her about things, and she wanted to do intensive care. And you know, and I think a lot of the thing is a lot of people don't like giving expert witness testimony, and it's frowned upon in the profession. Recently I've had very senior people say, "Oh, that's a minefield. You don't want to get involved in that." I thought, well, thanks for telling me now. I've been doing it for a wee while, but only if it suited me. Um, and it's it's something that ordinary working people should actually try and do, because the only other alternative is for people who've got time in their hands
Mm.
to start going about like heading a posse after Baron Munchausen's witch. You know, that's really what's been happening here. So, and that's how she's been treated. Um, and and there is an aspect to it. It's a bit like the banks failing. Nobody ended up with a high jump for that except the guy from the first one. But they were all like casino banking and not behaving like bankers should. They're behaving like gamblers should.
Mm.
Um, and there was this business of the big banks. They were too big to fail. They couldn't be left to collapse. And that was what was happening with this trial. The
Mm.
judge was contacted by somebody who said, this guy's an unreliable witness. But it's all set up. It's 5 years in the making.
Mm.
So he's got a big decision to make. And then somebody said a witness blabbed, a juror blabbed. And they said as much as, well, they've already made up their mind. And he kind of acknowledged it, admitted it by saying he knew the juror and had been very attentive, but he never went to speak to the juror and ask them accordingly. Sorry, allegedly.
Mm.
I don't mean accordingly. So, and the strangest thing is the downgrade that happened in the interim. So that they actually downgraded not to be as complex as this.
Mm.
So they no longer accept babies below a certain gestation. So that cuts out an awful lot of work. And then there was a big fall in the birth rate anyway. So again, that had fallen, but yet they were given a new unit and then doubled the consultant numbers. And they seem to have learned some lessons. But again, what happened in the appraisal? There must have been dozens of appraisals done over that time period. Why wasn't anybody saying, even in the appraisal, internally, without going to the press or anything, don't like what's happening? We're going backwards. We're giving away our good staff.
Yeah.
Don't know. don't know. I don't know how to describe it. Is it an upgrade to a lower level? I think that's how the downgrade would be described as. And yeah, again, it's right in front of you there in that image. And I think that image is it speaks volumes.
Yeah, it does. It does. So I was going to ask you some questions. So are you ready for the questions?
Fire away.
Let's go. So we've covered a lot of topics there. I've actually added a couple of questions to the list while you've been talking. So
You're a
let,
glutton for my punishment. Yeah.
no, I mean, we want to get as much knowledge out of you as we possibly can. So the
Okay.
first thing simply is a very simple question. Can air get into an infant system accidentally?
Well, I think, given the fact I've shown you accidental cases, and we know that procedures will let air get in, and I mean they're using high pressure ventilation is mentioned as one of the causes of air embolism in the list, and I'm sure things will happen. What actually has happened in the Leon Tanswell case is that a major vessel has kind of torn a bit, and it's letting a lot of air in. And what's happening is it's a bit like the air dancer that I was telling you about. There's an equilibrium, so it's filled up with air and it can't get any more in. And there's an equal amount going in as is being put through the system, so that what you see on that is an equilibrium status. You're looking at that as a point in time in that X-ray, and there's a big dilated vessel that's full of air, but what's actually happening is a gentle breeze blowing through it because it's got resistance on its own because it's distended. So there's an equilibrium reached where a small amount of air is coming in and a small amount of air is being circulated, and then it's gradually filling up the vascular system in that case, and you've got this big shadow over the heart, and that's air in the ventricle and the atrium at that stage. So I don't think I've answered your question. Well, as I say, if you just inject into the neck wrongly, or say a line becomes detached, or it's loose. If it's loose and something gets injected, then you might get a wee bolus of air going in like that. But all the descriptions are like very severe murmurs and things like that. None of that's happened. This is all retrospective. It's all made up. It's all Munchausen by proxy, dressed in a different coat, but the actual thing inside it is just the same.
Yeah. What about in a lot of these cases we're seeing multiple intubations. Can that result in air being accidentally introduced as well?
Well, I think when people said they accused her of dislodging a tube and causing bleeding, but they would already determined that there was bleeding from multiple tries, and it took somebody to come over from Liverpool to actually intubate the baby properly, and she got blamed for that as well. But yes, of course, I mean, if any air-filled vessel that gets damaged, then a tube can go through a vessel. Even a line, one of these umbilicals, they can go through the heart. It just depends if it gets caught. It can wear its way through, and it could go into anything air-filled, could fistulate into another cavity. So it could be the sac round the heart. It could be the sac that goes in round the lungs. It could be the sac that goes up the middle of the chest, called a pneumomediastinum. And any of these things can cause air to leak into the vessels because it's just another container that can be breached in the body. So any of these things. And in the abdominal system. So if the baby perforates that's another cause. It listed in the thing, necrotizing enterocolitis, is listed as a cause of air embolism. So there's no escape from it. It just depends how big your imagination is and the context.
Yeah. So another thing is that all the papers that Dr. Evans is relying on obviously relate to accidental embolism caused by high pressure ventilation. And there's no indication that he ruled out the causes in those papers. There's no indication that he did anything to rule out an accidental cause of that air being present. And in court, Professor Owen Arthurs stated that the presence of air may also be the result of medical procedures or placement. So you've just listed a load of possible ways that this can occur, but would you like to comment further on this? Like they just didn't even address the fact they can be there accidentally.
It was this Evans.
Yeah, so Evans himself
Aye,
made
right.
no effort, literally
Yeah.
no effort to rule this out at all.
Well, he didn't answer questions and they let him away with it. There were
Yeah,
questions put to him by the defence about these things. He was asked and they let him away with it. They just let him say nothing.
yeah.
What was the judge doing? Was he asleep? I don't know.
I don't know. There's instances where, he will be asked a question, he'll just say, as you say, he just won't want to answer it. Like I've already made a statement, he'll say. I don't know. I don't know what
You say,
normally.
his favourite one is, I've already answered that question, and he
Yeah,
hasn't, of course.
yeah, absolutely. Um, so I'm not sure what else we can say about that, really. I mean, he just,
No, I mean, it's incredibly, that, I mean, the whole defence was resting on the premise that it was totally ridiculous what the evidence was being presented was.
yeah,
That's what they relied on. Now, they could have had experts brought up to rebut it, but the problem was it was a multiple trial. It was multiple cases,
yeah,
so they could be asked. They could be asked to give explanations. And I've heard that it might have been that maybe some of the defence people were kind of bamboozled, as I would have been, by the insulin evidence,
mm,
and what was put forward by that. Because it's turned out that there's quite a bit of controversy about that. It's not as straightforward. So
no, not at all.
again, questions need to be asked about thing. But I mean, at the end of the day, there there was no evidence of any harm done by Nurse Lucy. Not no eyewitness, and it was all made up afterwards.
Mm,
And after legitimate coroners, pathologists had all given their evidence and were countermanded. And to this day, those babies' diagnoses haven't been established. Because I was going to mention about the extra. So I mentioned about a third column in the third will inquiry. That would be the medical cause, and you have to go back to the common item because he says it doesn't matter what the method was. It's Munchausen by proxy. So that's the implication of him saying on the TV, it doesn't matter. She was guilty.
mm,
That's the implication that I take from it. I think most people would take that.
yeah,
It's Munchausen by proxy, and there you are. And I'm not going to answer any more questions that, you know,
yeah. So,
and he keeps sending in reports and then talking on TV about the whole things.
so you
So
meant, sorry, go on.
yeah, carry on.
I was just going to say, you mentioned to me previously that Dr. Evans has fixated on this Munchausen by proxy in previous cases. So I just wondered if you'd like to talk about that a little bit.
Well, I don't know the previous cases, but I'm told that's what happened. I'm told there was a case where somebody had been bringing up their child with abdominal pain, and they'd gone to court, and the family had been split up. And later on, it emerged that there was a medical reason for the abdominal pain. But that could, that could happen. I don't know. Maybe that might traumatize somebody where that's happened. I don't know when they have reacted.
Mm,
Again, I'm putting myself in. I try and put myself in the other person's shoes. Now, there's a lot of people involved in this case who've kind of taken shortcuts, but they've maybe been told things and they've not been told things, important things that would have changed their mind. And maybe they should be looking to see what the new extant material is and whether or not that would have changed their mind or changed what they'd said. And then maybe they should write and say, well, actually, you know, this has come to my attention and I didn't know about it at the time, or I didn't realize its significance, because it's at the moment it's a train heading for the buffers. and there's going to be a big impact, and it wouldn't be a great train to be on, I think, for a lot of people.
Absolutely. I wanted to ask you about frothy blood. This was a question that came to mind during the presentation. So this is said to be a kind of characteristic or diagnostic indication of air embolism, that you get this frothy blood. I believe it's in the right ventricle of the heart. I could be wrong about that, but it's in one side of the heart, certainly.
Yeah, I think that's basically what I was showing in those images.
Yeah. So there is an explicit comment in the hospital at the time. I think this is almost certainly from the pathologist. It could be from the coroner, but it's in the third ward documents, and they say there's no frothy blood present. So that, am I right in thinking that should almost eliminate
Well,
the.
it's like, so for example, if I'm scanning a female patient and I'm doing the internal scan, and I've done, I've done the examination of, um, you know, the female organs, but there's other things on the scan, bits of things. So I will say, well, I'll look at whatever else there is that I can see, and I will say, well, I've looked at that bit, it's only partial, but I don't see X, Y, or Z. Well, I don't see X, Y, or Z, but I just say I don't see any abnormality. Or if I did, I would take it further. But it's part of the process of being thorough. So what I'm saying to you is that it might be a statement they might be expected to make, but it's only if somebody's maybe mentioned it or they've been trained in a particular way to say that. Because again, it's like a checklist again. A pathologist is basically running, like I used to do detailed anomaly scans on fetuses at 20 weeks, and you would have to go around the whole body examining. And so what's actually happening with the pathologist is they're trying to see as much as they can in the main areas that they can. But there is limitations to what they can diagnose. So it's a specialist area, post-mortem imaging. I have to say, I did go to the pathology laboratory one day, and there was a list on the wall of the pathology laboratory which said continual professional development activities, and number one on that list was medical legal work, because they would have to then, it's like, what's the term, where you learn by doing things, problem-based learning. So basically, they would know that their work was going to be put under the scrutiny of a court, and that would make them read up, check guidelines, check that everything was going or had been done according to guidelines. And that's one of the reasons that I like to do it, is to find out how our unit would do, how we would do, how I would do with things. And is there anything I can learn from it? Because it's obviously got to a stage where it's become a problem, so there's things to learn from it. So it's as much curiosity as thing. But I don't know if I've answered your question, did I? I rambled there.
Yeah, well, just if there's no frothy blood, would
Oh
that.
yeah, if there's no frosted blood, well, that just means there's none at that time at that spot.
Hmm.
You know,
Is
and
that.
well, as you've seen, it is kind of what you might say problem central.
Hmm.
Given the fact that blood would tend to, air would tend to gravitate there because it's the highest point.
Hmm.
Um, so I suppose if you were looking for frothy blood, that'd be the place to look for it. So
Hmm.
that might be a more significant statement, but I'm not a pathologist. And as again, again, the caveats for these things is none of us have seen the transcripts. They're all locked up. We've all paid for them as taxpayers,
Hmm.
and they're asking for hundreds of thousands of pounds to see them,
Hmm.
or something like that, tens of thousands of pounds. What's that all about? Do you know? I
Yeah,
mean,
I think it's disgraceful.
yeah. Um, we pay for the courts. Courts
Absolutely.
are almost a bit like a plaything.
Mm.
Um, that sort of vexatious people who've got lots of money can, get fairly subsidised service of like, okay, let's sue somebody.
Mm.
And then most of us that are working haven't got access to it. And you have to be, maybe on your uppers, really, really poor to get legal aid um, to get access to it. So most of the people that pay for it don't have any much access to it,
Mm.
and it's a bit detached and it's very opaque. I mean, nothing's like, all those um, transcripts in a case that was, it is public court. Why are they hidden?
Absolutely. I mean, I've said this should be public property. There should be no charge. It should
Mhm.
be free. Never mind like £100,000.
Well, what does what does a click of a switch do? In electronic terms, you can transfer huge amounts of data with a click of a switch, and it's not there's no expense involved in it whatsoever. But
No.
it's all been painstakingly, and it's huge amounts of staff to do these transcriptions as well.
Mm.
It's all part of a process that will come under scrutiny. But as I say, with all these things where people are having, the Prime Minister has to get up. I mean, the Prime Minister is the one who's ultimately responsible. And yes, he should get up in Parliament. He should say, yes, the legal system has failed, or the justice system has failed, and I apologise.
Mm.
That's not atonement.
Mm.
That's lip service. That's just them saying, okay, you caught us out. It's almost, it's almost insulting.
Mm.
You
Well,
know,
it is insulting, I'd say.
it is insulting. And so we've locked you away for 10 years. We'll give you some compensation, but you should be grateful for that.
Mm.
You know, your life is, if can you imagine, I just can't imagine what Nurse Lucy is actually experiencing. Must be despair. And the whole thing, it was again taking her vulnerability, at a time when she was vulnerable, and getting her therapy notes when she was writing, she was told to write down everything that came into her head, and she put a bit of it unworthy, and so have I done so? I must have done something wrong,
Mm.
um, and that's been, and it was on a page where it said I'm innocent, I've done nothing wrong,
Mm.
was also there, but it was being latched onto, and that's what people remember from the trial. That's what I remember from the trial. Somebody saying, um, "Oh yeah, she's in other words, she's admitted it," and I thought, well, it's not quite admitting it, but I don't think they would get away with that ethically. What did I know?
Well, I know I would have felt the same before I studied this case. I thought the standards for murder to prove murder must be far higher than it seems that they actually are.
Yeah,
I did so.
it's a beer, it's a beer pit. It's like a parliament. Parliament's a beer pit.
Mm.
The one that can shout the loudest.
Mm.
And as you say, it's a case of winning. If if it's a game to win,
Mm.
but the truth, you're asked to get up, and swear to the truth, but they can hide significant stuff because it might sway the jury. Well, that's supposed to sway the jury. Do you not think a 700-page report
Mm.
laying out what was happening at that hospital might have swayed the jury a wee bit? I think it would have.
I mean, it's the two things we've mentioned them both in this interview. The first thing is it's extraordinary that that can be excluded, and that is critical context, firstly. And then secondly,
But the trial is too big to stop.
mm, well, that's the thing with Dr. Evans. I was going to mention Dr. Evans. So they basically just allowed him to talk crap because the only other option would have been to stop the trial completely. And they just didn't have the guts to do that, or they didn't want to make their system look stupid. And I think, I mean, you've talked about the elitism of the court system. I still believe fundamentally that a lot of the high-ranking barristers and judges, they just view it as their system in which they preside over us.
Hmm.
I don't think they view it as our system at all.
No.
I'm sure they would refute that. I'm sure they would disagree with that, but that's just my perception and my view.
Yeah, although at dinner party they take a high-minded thing about it, but at the end of the day, it's what happens on the ground. It's the reality. The reality is that picture.
Mm.
That's the reality.
Yeah.
Babies need that at that gestation,
Yeah.
and that baby's got a great corner for its fight. It's got a great corner for its fight, and it's got its parents sitting there as well. And that was the other thing. The nurses in the unit didn't like talking about the thing when it was going on, because there were some parents that were so scared when they were listening to all the stuff that was going on, they were sleeping over in beside the cots, and everybody was on tenterhooks. And still to this day, I've asked, you have to be diplomatic about things, you know, because there might be people who would be outraged that you're thinking that, you know, and they don't know what the actual story behind it is, but they'd be outraged at thinking of you as supporting somebody who was a mass murderer. And that's not the case. And, you know, I'm not a fan of Lucy Letby. I don't know her. I only know from what I've heard, but I'm a fan of nursing. And I remember being a child sitting in the pavement. It was, what was it? Angels with dirty faces. Well, I don't know about the angel, but I probably certainly had a dirty face. And it was a very hot day, and I was almost fainting when I stood up. It was that kind of hot day. And then suddenly these nurses, the community nurses came, and honest to goodness, their uniforms were so smart. They'd made a dress military uniform look like the tramp's mission. You know, and they actually took the time to talk to us kids, and you know, the respect that were held in the community. And then, you know, it's still the case. People, when they hear somebody's a nurse, that's a great thing to be. And now we're hearing those headlines in the papers 2 weeks ago, it's difficult to recruit nurses. And if they don't, you know, they need to get these things sorted out and clarified, and there's going to be an impact. And instead of being valued, and the way they are in our unit, as I say, that they all work together so close. They all know what's happening. They keep each other informed. Yeah, you just have to. It's a pleasure to be in it and work in it, and you just have to sort of experience it to know that that's nursing as it should be. That's what I'd imagine those nurses with a uniform and a hot day, you know, and being kind and being well respected by the community. That's what nursing to me means, and that's what I'd like to support. I've got friends that are nurses and retired nurses, and I'm sure they were exactly the same. There's a picture in our hospital of one of the old Nightingale wards in 1948. It must have been, I worked out the thing. Now that was the old Nightingale wards, and one of them, there's a grand piano in the middle. So obviously it was kind of nice, the ward. There was sun streaming in from a park at the back into the ward, lighting up the thing, and all you could see was complete cleanliness. Everything was in its place. You know, it's like that incubator. Everything was spotless. The doctors were wearing crisp white coats in it. The patients were in dressing gowns. They weren't allowed to sit on their beds. They were sitting beside the beds. So that was the only thing that they had. Like we had against COVID, we didn't have antibiotics then against that. They didn't have antibiotics. All they had was cleanliness and ventilation and sunlight. And what would happen is, so the windows would go from, I mean, these wards were cavernous, but the radiator would go from quite low down, and then the window would start, and the window would go to the ceiling, and it would be capped at the top, with a metal cap on the top of it. And that meant you could open it in any weather, and if it got wet, it wouldn't rot. So they had ventilation whenever they wanted it. And they had sunlight coming and streaming in. And you would go to the end of the ward, and there'd be standpipes. You know, it would be an ordinary kitchen at the end of the ward, and they would turn the tap on. And in 10 seconds, you'd have great cold Scottish water. You love drinking it when you're at home. And you would have that. And that's what they had. And they had all these things, but that's all they had. They didn't have antibiotics at that stage. Well, it was kind of primitive. So, and that really struck me. And again, this business of the nursing staff, they've lost their status a wee bit as well. To my mind, the chief nursing officer is the senior officer, not the chief medical officer. To my mind, as the chief nursing officer that has seniority, she's full time. She's in charge of all her staff, and she's not doing a bit of clinical work on the side like the medical directors often are. They're doing, they're part time and they're doing other things. But to me, they're the senior ones. And I remember, and I'll use a nom de plume for the nursing sister. But I remember this lovely nursing sister, who you could see she was really fit in terms of any sort of arguments, and she wouldn't stand any nonsense. So in comes this very high-ranking professor. I mean, the whole of the medical establishment really, wouldn't dare say boo to him. And I think he had a registrar on tour with him with a very new portable TV, and he was saying, my relative's in this was a surgical ward. And he was my relative's in. I wonder why she's not in a single room. And of course, he was told in uncertain terms that there was somebody else that needed the room better in sort of medical terms, and it never happened. It never, that patient never went into the single room. And I think afterwards, the registrar put the TV down and walked away. And as he was walking out the ward, he got reminded of his TV to sort of, not forget it was coming out. But that was the sister Rosie. And she appeared gruff, but the staff knew she was fabulous, just fabulous, in terms of professionalism in that respect that I was talking to you about. And as I say, you're looking at the nurses today, they've still got it. It's there. But they seem, in that hospital setting, it should have been the nursing director was effectively bypassed. There was an internal inquiry first. She was exonerated, and the consultants were made to apologise. That would go down like a lead balloon. But once the police got involved and gave his senior witness license to operate, everything was countermanded, and that would be the senior nurse as well. She wasn't going to be able to even fight the police, but she would have been able to tell the consultants. A good senior nurse would have been an excellent witness for a defence, and even the staff that she worked with weren't allowed to say that they found her a good colleague to work with. What's that all about?
Yeah, I mean, that was just pressure from the NHS, seemingly, from the hospital.
But there shouldn't have been that pressure. What's the hospital got to do with the fact it's a criminal case?
Well, nothing. They're not
going to lose their reputation, are they? They're not going to lose their reputation. Well, one of their nurses has supposedly done something very bad, so that's a slight in their reputation. But maybe that's acceptable if it's the whole place needs, renovated and an upgrade to be downgraded. Maybe I don't know.
They needed so much doing, didn't they? Clearly, even now they don't seem to have recovered that much. But
well, they're second bottom of the league now. I think they were fifth bottom at the time, so they're not getting any better by the sounds of things.
No,
either that or everybody else is really doing well.
Yeah, we don't believe that.
It's the NHS. Now, the only time I've worked in the NHS my whole career, and the only time the NHS has been up to the mark was when Gordon Brown was the Chancellor, and he spent the money on it. Well, that's a big surprise. But we had no waiting lists. There was no waiting list for treatment, no waiting list for diagnosis. And, he was the last big heavyweight looking out for the health service. I think the rest of it's, I just get the impression it's, it'll survive,
Yeah.
And certainly I think the current health secretary, she won this like a ton of bricks. What's he doing? Why is this hospital still second bottom of the league despite an upgrade? Where is he?
Yeah.
And then it'll be again the Prime Minister will have to get up in front of the House of Commons and say, "Oh, we're really sorry. Oh, we didn't know.
Yeah.
I've had plenty of opportunity to get involved, but it's establishment again.
Absolutely. I want to ask you a question about Professor Owen Arthur's.
Uh-huh.
I know that you haven't seen this paper that he presented in court where he found that 25% of infants have gas in the large vessels. And those aged under 2 months, it was 8 out of 38 cases, it was 21%.
Is
So
this dead babies?
sorry, say that again.
Is this dead babies?
I'm not really sure. That's not, I don't know offhand, actually. That's a good
Well, you
question.
can get post-mortem changes. I mean, basically, decomposition gases um, can appear.
Yeah.
But I like you. I've not read the paper. I was hoping you would send it to me, and I could maybe give you a comment
Yeah.
later. But
No, I don't have that, unfortunately. I could find out the answer to your question, but I don't have the paper.
right, okay.
Obviously, so I firstly
Well,
surmise,
look, see, this is it. I mean, why? This is a paper that's been relied on in court. Why don't we have access to that?
yeah, I don't know if it does exist, like publicly.
Oh, I see. All right, it might have been unpublished like mine. My proudest paper is
Well, I think he
unpublished.
I think he just did it for the court case, as
Mm,
far as I understand it.
yeah.
He just did it for the court case. It was in court and then goes in the bin.
Oh, I see.
I
All
don't
right.
know. I mean, I don't think it's a public paper.
Well, obviously, if it's post-mortem cases, then thing. And as I say, I haven't seen any of the X-rays of any of the cases, so I can only comment in general about um, uh, the fit, if you like, of the expert witness. And maybe there was somebody they had in mind for the defence, but I don't know if they had a real radiologist for the defence or not. But um, you know, they often, if they've got one for one, they've usually got one for the other.
Yeah.
So there might have been other things, and as I say, we're involved in items that we don't know about because we know quite a lot about things that have been going on, but we don't know everything, and we have to be careful that we're not um, going over the score unless we can kind of almost prove uh, what we're saying. But many things are very obvious and require answering, and that's a caveat that exists, as I say, especially for the imaging, because you can't comment without the imaging and the context. I mean, even if you saw the imaging, it would depend on the context as what's been told in court, the actual thing. But I presume surely got access to everything, and maybe one or two of his team are suitably qualified to sort of comment on it. So we just have to sort of accept and go on their good offices. These people have got huge reputations, and they're not going to, they're not going to make things up.
Yeah, absolutely. Um, so I want to ask you as well about the logistics of injecting air, because I know you had a lot to say about that. So can you give me your view on
Well,
the,
if you look at that picture, where would you start? To be honest, you could go to the lowest common pathway. Probably that is probably, I don't know which one it would be, but they will be labelled. But you know, the actual inside of those vessels is really tiny, and you could only really the only syringes they have on the ward are kind of 10 mils maximum, I would think. And even then, somebody would see you, and you'd have to crinkle open a syringe, draw up air, disconnect a thing. Well, probably alarms are going off because you've opened the cot, um, and um, put it in, inject it. And the first thing that would do if a baby collapsed, if you come in and one of those lines was clear, there was nothing in it, it was just the air that was in it, it would be spotted. There's a resuscitation going on. People check these things. Um, is it's very much a case of it's a bit like a mechanic at a car. Is this in the right place? Has this been disconnected? What? It's a kind of a really rapid diagnostic process, and obviously maintaining emergency treatment at the time. But it's a case of finding out what's wrong. So, I mean, even if you look at the Lee and Tanswell X-ray, there's a chest drain in there, at the top of that thing. And I don't know the circumstances, but depending on the circumstances, that could be a problem. So when you're interpreting these things, you have to have the context, and it's context in microcosm when it's X-rays about what's significant for the context that you're working in. But when you look at the overall context, the Occam's razor, which apparently is it's for shaving away things that are unlikely. The razor shaves away unlikely things and leaves you with the stem, the likely stem of what the truth is.
Yeah. And then on top of that, how do you feel about the logistics of Lucy supposedly coordinating all these attacks without being caught, or even any fellow nurse having any suspicions?
Well, why is it down to me to answer that question when nobody's seeing anything? Do you know what I mean?
Yeah.
Nobody's made a diagnosis of air embolism other than his nibs. Nobody. Owen Arthurs didn't say it was air embolism, did he?
No. He wasn't really very supportive of the prosecution at all. In fact, he didn't give it any support, really.
Right. Well, I didn't know that, but
Yeah, no,
basically,
his evidence is not in support of the prosecution. All he really basically said was, "Oh, look, there's some air." I
yeah.
can't say it's anything to do with their embolism or
Well, I
deliberate.
mean, obviously, the prosecution will be dancing on a pin to get to air embolism. That's the pin they want to dance on, and he's probably been directed that way. But at the end of the day, there's nobody with an expertise in air embolism in that kind of practice. I would say, because if you've got a substantial department at all, it's all the evidence is all the expertise is all diluted, unless you saw each other cases, in which case you might get a wee bit more expertise. But I'm not aware of any significant air embolism cases coming up clinically, so it would have to be it would kind of be a strange subgroup where you would develop an expertise, the same as insulin poisoning in neonates. Who's got experience of that? We don't even know how insulin works properly in neonates. They're always out adjusting for hypoglycemia. I was doing the scan the other day, and one of the nurses was trying to get a blood gas or a blood gas and a sugar. Because the baby had been fasted before I did a scan, because they had to be, because it was part of the diagnostic test. They were worried it was getting a wee bit hypoglycemic, but it wasn't a straightforward process. It was a prolonged thing. I was finished the scan and away by the time they were still labouring to do it. It's time consuming work, and the work's involved in all that. So, to be honest, the logistics of somebody doing that, doing it so many times, it's, as I say, well, you could turn it to cyanide poisoning. Why wasn't a wee dose of cyanide being injected? Because it's the same thing. There's no evidence of it. So that was the reason I put the analogy in that it shows it was a common factor, but it also showed that the babies were dying for the want of all the care that we're seeing in that picture. That was what was happening. Their energy levels were going down, unlike the Duracell battery bunny. Their energy levels were going down so fast, and it's not something that you're aware of unless you try and take blood samples. I say that was 10 minutes. Somebody was trying to take a sample, and that was for sugar and a couple of things. But it would have been quicker just to feed the baby, to be honest, because I had finished at that stage.
Yeah.
And the other thing about the insulin is, giving insulin and infusion in a bag full of feed, and the food, the carbohydrate in it is glucose. And my 14-year-old daughter knew when I was sort of describing to her what had happened, she sort of knew about glycation. Well, I know about that, Dad, she said. But it sticks to the side of the bag. You don't give insulin by bags. And I think Doc McConville, he went through all that. He's done a fantastic job in highlighting the breaking of guidelines and how the the normal practice doesn't resemble anything like this. You could sit there with that image and start to go through his papers, and it would be the same common denominator at the end. It's the amount of care, and the amount of care that the people in your corner give you when you're in a fight like that. That's the difference.
Yeah.
It's a totally different scenario, totally different. It's a different universe. You've got that. They had something a lot less.
So I want to ask you as well about another aspect of the so-called diagnosis of air embolism. So Dr. Evans has made this statement. He made this in court. He's made this since the court, that he decided it was air embolism before he even learned about the rashes or discoloration that are central.
But what does it matter to him? Because it's Munchausen by proxy, really.
Yeah.
It doesn't matter. She's guilty.
Yeah.
It's just a line in a date on a thing, and he wouldn't answer questions on it. You listen to it, and you've shown the transcripts. Find out where he answers questions. It's very few, and there's usually a bit of a, it's quite a performance, really.
But I mean, so he obviously, we're skeptical about his role in this case, but he claims that he diagnosed air embolism based on a sudden collapse, unsuccessful resuscitation. That's it. I mean, is that even remotely feasible?
Well, you basically come down to probabilities again and context, and really, it's ridiculous.
Yeah. I don't think it's any more than that, really. I mean,
he's a very persuasive person, obviously, but it's a ridiculous scenario. Ridiculous.
So speaking of ridiculous, how do you feel about some of the other diagnoses in this case? For example, the supposed injection of milk.
Well, have you ever heard of that anywhere else?
No.
Has anybody ever heard of that? Well, does that not slightly suggest an alien would think it was ridiculous?
Yeah.
Without, we've all been heard as a trial and she's been found guilty. So we have a different context from an alien coming along who doesn't know anything about it. But if you said that, and it can be accidental. I mean, you might get told, "Oh, that baby's got query neck, and it's nil by mouth." In other words, they're starving the bowel, not putting any feed in so that it can rest. So somebody might not hear that and give a feed, but it's only a couple of mils. It's only a wee amount. I think some of the bigger ones, you maybe see a 5 ml syringe. Okay, I think it's a 5 ml syringe. You just see them hanging by the ceiling of the incubator, and they're just left to drip into the nasogastric tube over a period of a couple of minutes. But I don't think. I mean, I'm not a neonatologist, but I don't think I've ever heard of it. I think I might have.
Yeah.
If neonatologists have heard of it and it's quite common, then I take back all I'm saying about it.
No, I mean, I think for me, I can remember standing in my kitchen hearing about this for the first time, and I'm pretty sure it's when they started saying, she overfed infants with milk. I was like, really? I've never heard of that before. I'm pretty sure that was the thing that triggered me and made me thought, hold on a second, this sounds dubious.
No, but a witch would do that, though.
Yeah. It's just a very strange.
Yeah.
And actually, I don't know if you've seen
the only way to get the truth out of a witch is to test them.
Yeah.
And then, so if they die, then they were innocent. So
yeah.
It's kind of.
I don't know if you've seen the bit where I go over the court transcript where he's trying to defend this milk allegation.
I haven't seen it. No.
It's truly surreal, truly. I mean, it really is embarrassing.
Yeah. Well, as I say, it takes it takes quite a bit of nerve to stand there and do that. Do you not think so?
Yeah.
I mean, most people when they go up in court, they're a wee bit nervous, but
Hmm.
well, I won't bother.
I think it's a degree of arrogance as well. I mean, it's he just believes even when proven clearly to be completely wrong, he just still believes that he's right. I think
Well,
that
he doesn't come over as not being that way on the TV thing.
no,
So it may well all be an act. But as I say, if you had a third column, medical diagnosis would be psychiatric diagnosis of Munchausen by proxy every time. And then you're into the witchcraft thing because no matter what she didn't do, there's an alternative. So it's a self-fulfilling thing, and he's very consistent with it. And that's what struck me when I thought about it. I just thought, we all think he's changing his mind because he's changed his mind about X, Y, and Z. And you think, no, it's consistent. Munchausen by proxy. Because that's the underlying diagnosis medically.
yeah,
And then supported by the police. Well, where did the police get that from? Oh, she's attention seeking.
hmm.
What? Well, maybe to do with that thing. I don't know.
Yeah, yeah.
Quite
So I've got a few more questions left.
Okay.
Um, so you're obviously a generalist doctor as well as knowing about radiology. So are there any other areas of the court case science or medical matters related to Lucy Letby you'd like to highlight and discuss?
No, but I'd quite like to come back to you when I've seen. Well, I won't get to see that paper from Owen Arthur's that
I'll
he
try
gave in
and
court.
find it, but I don't think it exists.
All right, and yeah, so that's a pity. But yeah, no, I don't. I don't really think so. I think we've covered most of the things. If there's anything, that you need a question about, you could always drop me a line or something.
Yeah,
I'll put on one of your next things and just say, by the way, blah, blah,
yeah, yeah.
blah.
Uh, so just a couple of kind of summing up questions.
Mhm.
How do you feel about the scientific evidence that was used in court?
Was there any?
Yeah, I think
Because
that.
I'm honestly trying to think of scientific evidence. I mean, the insulin stuff was a load of rubbish because it was all radioimmunoassay stuff.
Hmm,
All the stuff about blood gases is all pulse oximetry.
hmm.
Um, uh, I think there was actually some blood gases taken at some stage, but in some of them. So what were the other listed down? Ear embolism. Well, as I say, radiology might pick that up. Uh, it would have to be, like if the baby was in a CT scan and got an accidental injection, like I showed you. But what that actually shows is, you can inject quite a lot and the person still survive.
Yeah,
But that's a huge amount on the Lee and Tanswell paper. I mean, that's a major cardiovascular compromise that's showing in that. But as I say, I don't know how it does in the other things. But we are biologically constructed,
hmm.
and as I say, images of things can be mistaken. You can be mistaken in your interpretation. Um, the eyes are fallible, as I've demonstrated.
Yeah.
Yeah. As I say, the scientific evidence. What is there?
Well, there's not a
I
lot.
mean, the insulin thing is. I think other people. I mean, I don't know anything about insulin.
Hmm.
I mean, I know the basic biology of it and all that sort of stuff, the hexamers and things that Michael was talking about. Um, but I think the appropriate people, or the most appropriate people, because there is no one appropriate. Nobody knows how insulin poisoning, hardly know how insulin works properly. When it's therapeutic, never mind when somebody's messing about with it. So I can't see how that can be scientific. And I think that's what people are arguing. People in the know are arguing. Or that's what I've been told. But as I say, radioimmunoassay is not a forensic test.
No,
So was any forensic test done?
no. absolutely not. I mean, this is another thing from the hospital. We talk about mistakes at the hospital. They There's just enormous gaps in testing that should have taken place that just didn't. You often see in the court case, it's like, oh, we should send this away for testing, and then there's just like a gulf.
Yeah.
It just disappears into a vortex, but
Yeah.
you just never hear about it again. It's very clear that they didn't do proper testing. So for example, you've had these third world lawyers saying, oh, there was no signs of infection, but they never did the tests. So
Well, yeah, as I say, sepsis can. It was part of the thing. Sepsis can creep up, and
hmm,
on one of those guidelines about sudden collapse, it does mention and it gives a breakdown of what you should be looking for in sepsis.
hmm,
And just a case in point, this week at the meeting, two of the neonatologists had a difference of opinion, and it was about um, whether or not they should stop a treatment to do with sepsis.
hmm,
And they both put their views forward, and both have got valid views. So it's a kind of a situation equipoise in that baby's got two consultants arguing over what's best for it. That baby lying there, again, we come back to that image, has got two experienced consultants having an argument, not an argument, but a discussion in front of their colleagues, their peers, about how they should treat a baby. And they're in that baby's corner. And you couldn't ask for any better. You couldn't ask for any better. People actually, well, not fighting, but they're taking, they're taking a stance for you and trying to give you the best thing, and then they'll come to some decision, and it'll have been made openly and uh, bearing everything in mind. And the person who stopped the treatment said, "No, I've got my answers about sepsis, and I don't think there's any sepsis. And we've had the baby long enough now that we can be confident that there's no sepsis." And that's evidence-based medicine, as he was epitomizing, I think would
yeah,
be the word. And yeah, absolutely no way is that baby not going to get fought over. As the fight is just um, it, it's just a different universe from just having a peripheral line in and not doing any, having pulse oximetry and all the things, you know.
yeah. So that's absolutely great. So just one final last question. It's just simply, how do you feel about Lucy's case at this point in time?
Um, well, given what happened to Malkinson and the time that took, I think what's needed is a drama.
Hmm.
Get that guy Toby on to do his Shuley, get somebody to write a quick drama, 3-part drama or something, like they did for the post office. Because you're coming from a position further back than the post office ones, in that there wasn't a nationwide acknowledgement that anything was happening with the post office. Whereas this person has been well and truly pilloried. And as I say, it's embarrassing sometimes to talk. You have to use hushed tones to talk about it
Hmm.
in case you offend anybody. Oh, you're not supporting that, are you? Well, actually, it's not what you think. But I don't mind. I don't mind telling people quietly what's going on with it. But it's getting it out there. You'd be surprised how many people don't know anything about it.
Hmm.
People working in the hospital, even people you would expect to be familiar, and they just take the establishment line and what they're told.
Hmm.
But you only have to look at well, you only have to look at politics in general and know that there's a lot of there's a lot of things, a lot of fake news about that people believe. I mean, talking about scientific evidence, I mean, America's been importing scientists for years starting with the Nazi scientists. Immigration for years. Before that, at the Statue of Liberty, your huddled masses, all these clever people. And then the brain drain. It was the British that were suffered from the brain drain in the 60s, 70s, and 80s. Currently, it might be the opposite that's going to happen. But basically, if you've got a country where 50% believe that life started, human life started 4,000 years ago, and that was the start of all life, you're going to have a difficulty getting a scientific basis for things, So we have a fantastic. This is the thing that was the thing about the demise of Gordon Brown. We have a fantastic free education system in this country, and he got demise because somebody's grandchildren couldn't get jobs. And we have a free education system. So anybody that can't get a job, you wonder what happened to their education. And we all have a free choice in these things, but it's totally undervalued. And we don't want to see nursing and all these sort of things go away because people aren't keeping themselves educated, or it's slipping. And there's lots of my family are teachers, and they do a fantastic job. And but it's the same. It's how they're regarded. And we all know that things are difficult. But it's one thing that this country's got that a lot of other countries don't. But free education, and people should be encouraged to like those community midwives saying you need to stick in at school. She didn't say that, but she would have said it if she if I could go back and remember what she said. So anyway.
So, I mean, do you think this whole debacle is going to have a negative impact on nursing, or already is having a negative impact?
I think it already is. If they're having difficulty recruiting nurses, and I mean, there was a real perception about how brave nurses were during the COVID, and that is true. They were brave. Some of them let themselves down. I mean, some behaving not so well, but you get it's the same in every walk of life. You get a variation in how well people do with regards to things. But I do believe that it's something that I've always had a high regard for, and I think these sort of stories sort of why would Lucy was so proud of her nursing degree. I think the family put the thing in the paper. I think you said the other day there was a
little thing saying congratulate. I mean, she's probably the first person from their family to graduate, to go to uni. I mean, that breaks my heart, I think, more than anything.
Yeah.
Just seeing, well, I mean, I know I've met someone who knew Lucy now. I can't really say too much about that, but she said like they were so proud of her. Like you can't, is their only daughter, I think, as far as I know. It's just devastating to see that in the paper.
She was apparently an exemplary person. I mean, she's had her life put under the microscope. They've been searching in her bins, searching under her bed, searching for everything, searching her garden, ridiculous. But and all they could come up with was a smutty joke said sometime.
Yeah.
And it wasn't even smutty because it's common fodder in films and things.
Yeah.
There's absolutely nothing to it. And the ethics involved in bringing that up in a court case.
Yeah, I mean, it's dubious whether they should have brought it up, frankly. But I mean, everything seems to be okay. No one seems to object to anything. I find it all very strange that the whole court process. I don't know. I don't understand how.
Well, maybe they're right about it being a minefield, But I've certainly been involved in a couple of things that have got perverse outcomes, but they're way off the scale with this.
Well, you
you
just,
know.
I mean, I don't understand how the judge is sitting there watching them going on about, oh, did you own a shredder and did you have pajamas when you were arrested? And like this is considered legitimate.
Well, it pales into significance when there's a 700-page report getting excluded.
But yeah, but that's out,
Right.
that's out, isn't it? That's out. You're not allowed to have that in the court
Yeah,
case. But we'll have a 15-minute discussion about whether or not you owned a shredder.
yeah.
I mean, it boggles the mind, truly. It really is unbelievable.
It's very weird. As you say, an alien coming from Mars would just shake their head and go back again.
Yeah, yeah, absolutely. Anyway, I'll stop you
If,
there.
if an alien's clever enough to get here, I don't think they would want to be here.
No, no, that's a fair comment. Yeah, I'll stop you there because you've given me a lot of your time now, and really
All right.
for going through all these things that I know very little about.
Mm-hmm.
I'm sure people are going to enjoy watching this. So thank you very much for your time, and we'll
You're
keep.
welcome. And as I say, it's for a very worthy cause. I mean, people are imprisoned through being falsely accused, transcend um, other other sort of what you might say inhibitions about being uh, slow to come forward with statements and things, and taking everything on the face value. Um, I hope I've been consistent with it.
Yeah, no, your expertise and knowledge and experience is very much appreciated. So thanks very much for joining me, and I'll keep in touch, no doubt, and I'll speak to you again at some point.
Thanks very much. And
Thank you.
I'm no relation to Malcolm X, Ray X.
No. No one can see that. No one can actually see that we've written on the screen, actually. But it was a good joke. I thought it was a great
There you
joke.
go.
Anyway, yeah,
Well,
thanks again, and take care.
okay, and I know how much you're doing as well. And there are other people. And as I say, um, uh, I think the person in the drama should be surely um, that's that's the dramatis persona. But there's a lot of people that should be supporting roles. I'd put you and Michael McConville, and there's a lot of people that have got podcasts. I mean, there's According to Carl, and there's Stuart Gillum and various other ones, and they're all doing a terrific job trying to sort this thing out. And
Yeah,
just wish them all the best.
yeah, I agree. So thanks for that, and yeah, as I say, I'll keep in touch, and I'll speak to you again soon.
Right. Thanks very much. Are
Thank
you
you.
going
Bye.
to end? Are you going to end?
Yes, yes.
That's fine. Thanks very much.
No worries. I'll end it. Thank you. Bye now.
Bye now. Bye.